when we read your name out there, it says minimally invasive surgery. That means you don't really burn holes into the skull.
So I do different types of surgeries,
right.
but my major trait is minimally invasive. That basically means I do endoscopic brain tumor surgery.
So let's explain it out to the common man. When he says endoscopic, it means he's doing it via camera, going in there, not necessarily opening it all up, so you don't have to, feel scared about it.
But it's
right?
not every tumor that I can do minimally invasively, but there are certain specific types of tumors that cause pressure behind the eyes, actually. Pituitary tumors, that I tend to do endoscopically, that people don't have a
Can you mention a few symptoms of pituitary tumors so people know that if they have exactly these symptoms?
So I'll tell you, I came here, I started endoscopic surgery. Brain and spine, I started minimally invasive spinal surgery as well at the same time. And just like, I think 2 weeks ago, I operated on a patient who had two surgeries through the nose, and including one major surgery. Both were done in London, okay? And of course, he could afford it. Not everybody in Pakistan can afford to go and have surgery in London. In the same hospital that I was trained, okay? So he had surgery done in 2013, I think, at that time. He had a brain tumor. 2 surgeries done in London is quite a lot of money, okay? You can buy a house in, I don't know, Barrier, I guess, for that much money. Then he heard of me. Of course, people ask for most things, this, that. He came to me and he said, he needed 3rd surgery definitely because he could not see properly. So one of the major things that patients present with is they can't see properly, they get double vision, they get reduced vision. So anyway, he came to me, I operated on him, and later on his son came to me and he said, "Is this the bill?" I said, "Of course, this is the bill." Usually I don't tend to divulge or go into the discussions of whatever the bill was, but the bill was so less that he was surprised, actually. He said, "That's very little money you've charged." I said, "Well, it's a lot of money for a poor person in Pakistan, but for, of course, I mean, children are very different as compared to adults in their whole anatomy and the way they present and the diseases that they have. So normally children don't get headaches, okay? I mean, there are children walking around everywhere. They don't get headaches. If a child is saying that the child has got a headache, I think that needs to be taken seriously.
That should be taken
And having said that, just again, I'll mention today I saw a 14-year-old child. Yeah, of course, she's a child. And she had headache, and I referred her to a local hospital because she was out of the area. And it turned out to be, her father was a doctor who rang me, and I, like, via appointment system anyway. Turned out to be meningitis.
Oh.
So in a kid, got investigated and all that. But first point of contact was the child had a headache, got an appointment with Dr. Akbar, who's a neurosurgeon. Yeah. I told him, listen, the kid has got a headache, they need to go to ER and get examined by a pediatrician. Yeah. And then I told him, you need to tell me as well what happened. And then he calls me back and says, yes, Dr. Akbar, it's a meningitis. I said, anyway, so she got treated and whatever, but in children we need to be careful that if they are vomiting, they've got headaches, they can't see, they can't read properly, they get pressure behind the eyes. That's a serious thing, okay? So I tend to operate on kids as they come, I mean, fairly regularly. I mean, they tend to have brain tumors as well. And
does it affect their vision, their speech,
it does.
their
it does
writing,
affect their vision,
memory,
speech,
judgment?
Yeah. If they are walking, they can't walk normally. If you notice any change, actually mothers are quite good. Good thing about Pakistan, there are many good things about Pakistan, but what I'm talking about in neurosurgery is that overall the disease presentation in Pakistan is very late. But when it comes to children,
the mothers are
very up to the scratch and properly, and the kid comes to the proper diagnosis very quickly.
Okay, that's good.
So that's a very good thing in Pakistan. But patients themselves who are grown up, they tend to ignore stuff, and they are still presenting pretty late. And of course, there is then variety of opinion. I mean, opinion varies. I mean, I do for example, brain cancers. I deal with them very differently as compared to most of the people around here. And I tend to be fairly aggressive in terms of taking the tumors out and trying to, because every bit of tumor that I take out gives an extra month to that patient's life.
So that is very
And
important.
type of headaches. So for young people come and they've delayed so much. I mean, I had a
has
patient
spread.
come from I think somewhere in middle of Punjab, and they traveled all the way. And the patient was so delayed that the patient never made it actually out of ER. I decided not to operate on him because I think he'd missed the boat. He would not have survived.
So this is the kind of awareness basically that people need to have, that if they do have a headache, they needn't just ignore it. They don't have to ignore the signs and symptoms, and they have to go in for all the investigations that the doctor has prescribed, right?
But one thing I have to tell you guys, okay, don't come to me with simple headache. I'm a neurosurgeon, okay? So if you come to me, I think the first thing is to go and see your general practitioner, a GP or anybody. I'm sure they work out like basic investigations.
Actually, you know what?
everything.
This is a specialist like yourself, Dr. Akbar, available here. So you can go up to him, and then he runs these series of tests on you and sees that there is something dangerous.
I will
or
say
not.
one thing,
Yes.
which you have said quite correctly about headaches. Headaches can be very sinister.
Yes.
Just think about that. And if they are simple headaches, do not ignore any headaches that are not settling. Do see a doctor.
Okay.
But of course, only come to me once you've had an MRI scan.
And make sure